Hello and welcome to another Mayor's Emergency Response Roundtable. It is March the 15th, and here we are again talking about the pandemic. Just was reminded a few minutes ago, this is actually our 11th time coming to this roundtable to talk about different aspects of this pandemic, including opening and closing schools. We've met with superintendents, we've met with our emergency response team folks have been on, our manager and health director, talking about opening and closing services. There have been a myriad of issues and topics and questions that our citizens have had during this last year dealing with COVID. And so today we're going to center on one question, and that's the vaccination process, where we are, where we've been, some of the challenges that we have faced. I am pleased to have our health director, Dr. Nancy Welch, here to talk about it from a perspective of where we are as a city, some of the things that we have done in the city department has been through our city manager, Mr. Chris Price. He's here as well today, so I'll be asking them a few questions to hopefully answer the many questions that you have sent me by email. I know that getting your shot has been a real challenge, and we're going to talk about that, talk about where we are. And so without further ado, I'm going to start with you, Dr. Welch. Would you mind just sort of updating us with the vaccination process?
Sure. Let me first just sort of update you, if I may, Mayor, with just some basic COVID information. You have a slide, I believe, before you, which does show hospitalizations, deaths, and our case count. I do want to say that probably our case count is much higher than that because a lot of the cases are not reported. They're either asymptomatic or the tests are not reported. If we can move to the next slide, I want to put this in perspective of actually the progress that we've made. If you look at this, I'm going to draw your attention to the 7-day average of new cases reported, which is 41. And then if you pull up the next slide, Heath, you will see, you don't need to see the numbers there so much as you need to see the picture. And we have been up to over 500 new cases. So we have definitely made progress. We've gone through a lot of bumpy roads here, and a lot of families have been affected, but we are definitely on the right track now. And if we can move to the next slide, I'll demonstrate where we are. I know it's difficult for a lot of individuals to get vaccine because we are following based on risk. But let me share with you how well Chesapeake is doing, and I'm proud to say that we are ahead of the state average. Currently, almost 30% of the adult population has received at least one dose. Now, of course, this includes your 1A, your 1B. A lot of the 1B are essential workers and over 65 years of age. If you look at the entire adult population, 7.8% have been fully vaccinated, and 33% of those who have been vaccinated are fully vaccinated of the total population. I want you to, for comparative purposes, the state has about 19% of the population that's been vaccinated. So we are definitely moving ahead. That last sentence, percentage of the population with antibodies, that's again a guesstimate, but it's based on a combination of those who have been vaccinated and those who have had the disease. So almost a third of our population, and my guess is it is a third because we don't know all the cases, have antibodies.
Do you mind if I interrupt and ask a question?
Absolutely.
Here? Thank you. So one of the things that we've heard throughout this process are people who say, I have a parent who's 75 years old and can't get vaccinated. And I don't know what the numbers are. You may or may not know. I should have asked you prior to so you could have had this information. But assuming that our 65 and older population is somewhere around 13% of our total population, if that is accurate, if you look at this percentage of people overall, if you were to take the number of people vaccinated and by the number of people over 65, I think that number will be somewhere in the 70 or 80%.
Well, it's going to be a high percentage. Truly, almost 60,000 people in Chesapeake have been vaccinated. I've not compiled all from last week, and there was a lot of vaccination going on last week. And probably about 2/3, so you're right on target, of those who are 65 and older have had at least one vaccine, not necessarily two.
Right.
We have a unique model here in Chesapeake that has been a tremendous help from the get-go, but it does mean we're not doing a lot of promotion, and that's the disadvantage of the model that we have. From the get-go, we knew that an asset of Chesapeake is that we're a very collaborative community. I've lived here long enough. I know with the city, with the providers, with you, it's very much of a team family effort. And so from the get-go, we wanted to capitalize on that. And so we hired 2 nurses whose sole purpose was to get the providers and pharmacists vaccinated and get them on board so they could vaccinate. And currently we have 27, 29 of these providers, pharmacies, and practices who are vaccinating, and then we have up to 60 total who have submitted applications, but the process through the state is a little convoluted, so it takes a bit of time. If you map out all of these providers, they're spread throughout the city. And our philosophy has been, we want our citizens to have great access, not just one access, a mass vaccination, but have access throughout the city and in a smaller environment where they're comfortable.
So
Yeah.
this, I want to be clear to people that are listening, make sure they're understanding exactly what you're saying. So we have been criticized by some who say, you're not doing as much as other local areas. That's because we haven't hit the headlines. But the reality is, and the method that we have been using by getting it out and not making public announcements of large people showing up and not being able to be vaccinated, we are actually doing a better job, a more efficient job. And let me just add a comment. This is, Chesapeake, as you said, is collaborative. And we did this without any really good leadership at the state level. In fact, there was hardly a plan, hardly communications to localities about how to get these vaccines out. And so we sort of made it our own path and our own direction with you, and as you said, with city manager and the emergency response team, all of that because that's who Chesapeake is. Thank you.
Well, that's absolutely true. And in fact, this morning there was an email from the central office, and what do you know? They're saying, we have contracted with folks to help localities get pharmacists and providers engaged in order to provide vaccines. So yes, our Chesapeake model is catching on. The weakness of our Chesapeake model is that we don't do a lot of advertising and promoting, because the pharmacies don't want a lot of people. It's all by appointment. Everything that we do is by appointment. And the health department focuses on the wait list, which has about 30,000, but through our IT department, we're able to also filter out those who've been vaccinated. And that's cumbersome to give to our pharmacy, so we don't do that. So they do it by appointment only, but they don't want a long line of folks just lining up. So what people need to do, and I believe Heath has the link over there, is go to Vaccine Finder. And that is a way that you can put in the city that you are interested in. You can put in, I'm willing to go 15 miles, 30 miles, whatever. And they will tell you all the locations that are providing vaccine and how to make contact with them so that you can make an appointment. Everything is by appointment, so you can go in, go out, 20 minutes, easy as pie. And that's really what we think is in the best interest of our citizens.
So I interrupted your presentation. Did you need to go back to that part?
Unless, I'm sure if there are questions coming along, you ask them and we'll go there.
Oh, okay. You're okay for now? All right, let me go to you, Mr. Price. Could you talk to us for a moment about what it has been like for you in a different seat? As I said earlier, the state, I don't think, really called you or other city managers and said, look, we're getting ready to give all these vaccines out to people. Can you help us? Or here's the plan. Did you get any direction, and what have you done about it all?
Well, it's certainly been an interesting year and challenging year, but first of all, thank you for the opportunity to do this again today. I think, as you mentioned, it's our 11th time with a roundtable. I think it's a great way to provide information and resources out to the community. But you're exactly right. It was 1 year ago last week that I declared a local emergency here in Chesapeake, and we did that with all of the city managers across the region in a coordinated effort. And that's really been our mantra throughout is coordination. We try to coordinate here with the city and the health department. We try to coordinate with other cities and our state partners. I've told you this story before, but on the day I declared the emergency, our emergency management folks slid a plan across the table for my signature, and it was a global pandemic plan that they had been working on for years. And I'm thinking to myself, I'm a brand new city manager to this community, and it's amazing that our team's been working on this. And I'd love to say that we followed the plan exactly, but if there's one thing everybody should know is to be successful, you've got to be adaptable and responsive to change. And this thing's thrown a lot of different elements at us that we've needed to adapt and respond and change. And so we've been through phases at the beginning of trying to provide critical services and keep our services open, keep people safe, get personal protective equipment out there. And then we've moved into what we're talking about today, that the vaccination stage. And as you mentioned, there hasn't been a ton of statewide direction. So when we sort of left for the holidays, we really expected the plan seemed like it was moving towards mass vaccination sites located around the state to be operated by the state. The limiting factor, of course, is doses and vaccinators. And so given that it's a state function, the state was procuring doses from the federal government and a supply of vaccinators. When we came back from the holidays, it seemed like there was a pretty significant shift that was not likely to happen. And so fortunately, because of our relationships and because we've been in this game for so long now, so comfortable with each other, we really quickly spun up into what Dr. Welch referred to as our distributed model. And so we've used a variety of city facilities, we've used churches, the hospital, now our private pharmacy networks, lots of different facilities to be able to distribute the vaccine throughout the community and to a variety of populations. So I think that's been very successful. And as Dr. Welch noted, that's a model that's been talked about statewide and is now in use in other communities. I think the real key to that is as I mentioned earlier, that adaptability and responsiveness. But that being said, we don't rest on our laurels. So while every dose we've received here in the city of Chesapeake is now in somebody's arm, I think that's another misperception, is that there's doses just sitting around, and that may be the case in other places. That's just not the case here. All the doses we've received have been distributed, but we are anticipating a greater number of doses to come in the future. Don't know if that will happen, but you don't want to wait for it to happen and before you start preparing. So we're going to maintain that distributed network, but we are planning to execute mass vaccination efforts should the time arise that we have both the doses and vaccinators. So we're optimistic about that. Since the city doesn't control the doses, the only thing we can do is secure a facility, stand it up, outfit it with the necessary equipment, outfit it with the necessary staff, call center resources, and others. So the city's done that. We're prepared to maintain this distributed model, and we're prepared to pull off mass vaccination events should doses become available from the federal and state governments.
That sounds outstanding. I tell you, it's we call it in the education world, monitor and adjust, and that's exactly what the city is doing thanks to your leadership. And I really do appreciate this so much. Ms. Price, you just mentioned the churches, and kind of want to go back to you, Dr. Welch. I think it's pretty well documented that people of color are more susceptible to COVID and more susceptible to actually dying from COVID. someone in this team made a decision to go to some of the black churches. And I've heard from black pastors who have told me that, many people in their community, in their congregations, are not all that trustful of the medical community in general. So it was a brilliant move to take the vaccine where people will feel trusted to go, and that's to their church and under direction of their pastors. Would you like to comment on that?
Absolutely, and a wonderful partner on that has been the hospital. They really deserve most of the credit for that. And I do want to say that not only are we interested in addressing the minority because they are at higher risk, they have 3 times the rate of hospitalization or of death, but it is also a benefit to the community. Sometimes people feel a little taken back if one sector of the community is addressed. And the hospital has historically been overwhelmed with this COVID because of so many hospitalized, so many on ventilators. And the reality is, if you or I have a heart attack or a car accident and we're taken to the hospital, we don't want the hospital to be overwhelmed. We want them to be able to continue to provide the quality care because they have all the resources and staff available. And the best way to help them to do that and to concurrently serve our constituents is to be able to get the vaccine to the high-risk population. So the hospital has willingly taken on that oversight and that sort of portion of vaccination, and we have always been able to get supplemental vaccine beyond the usual allotment that we give to the hospital so that they go to the churches. They're working on some second doses coming up. They've already gone to 2 churches. They have another one coming up, I believe, next week. And I know that the hesitancy is a question, but when their own pastors and the congregation come and approach them, they've given 1,300, 1,600 doses at an event. There has been no hesitancy. They come and they get vaccinated, and they are grateful for it.
Yeah, we were able to visit one of the sites when they were doing that, and you're exactly right. The people come in. Every site that I've visited has been one of excitement, congeniality, those giving it and those receiving it. So it's been a good thing. And I think you're right. We should obviously mention the role that Chesapeake Regional Medical Center has played. They have been a major partner in this effort. Reese Jackson, I think, is for his leadership, and Robert Culpepper has been very involved in helping us or coordinating with us in terms of facilities, getting even our city employees vaccinated. So the Chesapeake Regional has been a godsend to the city. As a matter of fact, I'm not sure if either one of you want to address this. When just a notification and registering people to get their vaccine. I believe the state's program was a failure when it came out. The hospital stepped up using their software and their program. Is that correct?
You're being polite. Yeah. The
Not
system
really.
did not work and continues to have problems. And yes, the hospital had stepped up and actually permitted, they provided through their lifestyle center the opportunity for a large medical groups to vaccinate their patients there. And so it really was a huge, huge benefit. The system that the state has does have some benefits in terms of noting who's been vaccinated, but the biggest problem was that if you sent out the link, you had lots of people who shared it, and that did create a problem. And this is another reason why we do it by appointment only, so it can be a smooth flow, because that is certainly essential.
So let's look forward. Let's start to talk about next steps. I know that we are told over and over, even if you've gotten both vaccinations, to continue to wear the mask, continue to keep your distances, and continue to wash your hands. So do you want to talk about that at all?
Yeah, certainly, because that seems like a confusing point, and I get it. And the reason that we are at this, if you want to call it confusing point, is simply because, remember, this was an emergency use vaccine. So it has not gone through the years of study that others have. So while we are administering vaccine, we're also still gathering data. And the question is not so much that you don't get antibody response. Actually, with all 3 vaccines, you get good antibody response. You get major reduction in severity of illness, major reduction in hospitalization and ER usage. But you still may be prone, is the question, to be infected, even if you don't get sick or you only have a mild illness. The question lingers, can you still be contagious? And so that's why, until we gather more information just by numbers, that we recommend, especially if you are in a closed environment, that you wear the mask. Now, CDC recently came out with some guidelines, which I think make a whole lot of sense. And that is, if you have completely vaccinated persons, you can visit with each other without the mask. If you have there are still limits on gathering, but especially now, I don't know, I think the meteorologist confused spring and winter this morning, but if you're outdoors, you can feel a lot safer because there's greater circulation of air. And so that virus sort of moves around and won't be as concentrated. So they are certainly easing back on some of the limitations, but we need to be wise in how we do that.
So there's also, I want to talk just a moment before we conclude about the Johnson & Johnson. I know that that's a one-time, and the word is that it's not as effective as the Pfizer or but it is out there. And what about people's reluctance to take something that's not as effective?
Well, it depends on how you're defining not as effective. The percentages of effectiveness are related to your chances of getting infected. What is key for all 3 of these vaccines is that they are completely the same in terms of their effectiveness on reducing severe illness, on their effectiveness of reducing hospitalization and ER visits, and on their effectiveness of reducing death. They are completely comparable on those major determinations. But with the J&J, as we sort of call it, with the J&J, there may still be a greater chance that you might get a mild illness as opposed with the Moderna or the Pfizer. So it would be more like a cold. Let me just do a comparison. Flu vaccine is historically only 40 to 60% effective, but we still push it. And why? Because where it's most effective is exactly as these 3 vaccines in preventing major illness, hospitalization, emergency room visit, and death. But even with these 40 to 60% effectiveness with the flu, some people may get mild flu symptoms, the same as it is here with COVID. The J&J, there may be a greater chance you might have mild illness, but with regards to the major impact of severity, they're all the same.
I guess that sort of balances out for a lot of people. A lot of people who really hate getting shots, period, would prefer one shot and also the convenience of one and done until the next time. That's, if it's needed as a booster, is very appealing. And honestly, if it's just going to be a minor symptoms, then I guess that would be, at least from my perspective, I would take one shot and know I'm not going to either die or be in the hospital. So did want to talk before we end, Mr. Price, city services. Where are we in terms of, I know we've stayed open and provided basic services, but what do you see happening in the months to come?
So we've continued to try to lead the way on this. We were the first city in Virginia to reopen after the governor's lockdown ended. We continue to provide all services, but as I mentioned before, with our having to be adaptable and respond to changing conditions, we've had to alternate the way we provided services from time to time. So we've moved to remote service delivery. We've moved to some teleworking. We've had curbside pickup at libraries. appointment-only scheduling at our community centers, and some of those things still remain. So while we're open for services, some services remain on a modified schedule. On the vaccinations, we've really focused on essential employees, so the people providing your fresh drinking water, and our public safety folks, and really just the key essential personnel. The key to maintaining and fully reopening all city services is being able to continue to broadly deploy vaccine, but I'm very sensitive to the notion of I don't want city employees jumping ahead of other folks on the waiting list. So it's a balancing act of trying to provide services in the best manner possible for our citizens and keeping everybody safe. So the services that are open right now that remain on a modified schedule, the one people ask about most is libraries. I believe the plan is to reopen. They're available for curbside pickup right now, to reopen libraries at the beginning of April. We will really heavily push out that date when we have it, because it is one that people ask about most frequently. But even as Dr. Welch said, even as we're opening these facilities, you're still going to see people masking up. You're still going to see some of those plexiglass barriers and some of those distancing measures, because while we're nearing the finish line, we're not yet at the finish line, and it would be a real shame if we've gone through all of this and then have to go backwards. So we remain forward-looking. We remain committed to being a leader and staying open for business and providing those services on behalf of the community, and certainly, just like everybody else, we're looking forward to the day where we can declare mission accomplished and put this thing behind us.
Thank you. Dr. Welch, any final thoughts?
The best vaccine is the one you get first. So go to the finders, the vaccine finders. Know that there are a lot of resources. We are getting more vaccine, and we are distributing it heavily.
Now, I'm assuming that we've put that up on the screen. So,
Yes,
but
Heath put his thumb
could
up.
you just say how to find that vaccine finder? Is it on the Virginia Health Department
No,
website?
if you just Google vaccine finder, you'll get
Okay.
it.
So I think that's one of the major takeaways from this
Right.
meeting is if you haven't gotten your vaccination, you want to get there and find out where it's available, go to Vaccine Finder. The second major takeaway, I think, is clear is that Chesapeake is doing better than most in terms of getting the vaccines that are available to our citizens, and that's what's so important. We all look forward to that day where more than 80% of our population, from 30% to 80%. And so we ask our citizens to continue to be diligent and continue to wear your mask, continue to keep your distance. Tell your neighbors, especially those that are not as connected with internet and so forth, how they might get their appointments as well. Any other thoughts from either?
No, sir, just other than thank you again for the opportunity. I think providing information is one of the best services that we can provide, and we really appreciate it.
I appreciate both of you being here once again. I know, Dr. Welch, you're very busy at this particular time, so thank you for taking out the time. And you've done this every time I've asked you, so I certainly appreciate it. Mr. Price, thank you very much. Thank you all. Have a great day.